The ApiFix procedure is a less invasive treatment for select patients with adolescent idiopathic scoliosis. The ApiFix procedure achieves curve correction while minimizing recovery time and preserving spinal motion. The procedure uses a posterior approach familiar to orthopedic surgeons and involves 3 anchor points on one side of the spine. This is less invasive and less complex than other surgical treatments, including fusion and other fusionless procedures. Eligible patients include those with AIS having Lenke type 1 or Lenke type 5 single curves measuring 35 to 60 degrees, which reduce to less than or equal to 30 degrees on side-bending X-rays. To begin the procedure, surgeons expose the concave side of the spinal curve. 3 pedicle screws are placed to serve as anchor points for the system. The self-adjusting rod and extender are then prepared. The self-adjusting rod allows the ApiFix system to grow with the patient. The 2 polyaxial joints allow a degree of motion that is not possible after fusion surgery. The rod and extender are then placed and tightened onto the 3 pedicle screws. Near the end of the procedure, an instrument is used to expand the rod and achieve curve correction. The self-adjusting rod passively allows for additional elongation postoperatively to accommodate for growth or additional curve correction over time. The ApiFix procedure usually takes less than 2 hours. After the procedure, patients typically stay in the hospital for 1 to 2 days. Patients are usually back in school within 2 weeks. Return to certain sports and activities can begin 4 to 6 weeks after the procedure. The ApiFix procedure is a viable, less invasive treatment option for select patients with AIS.